relax, and celebrate and catch up a little bit. Of course, safely and responsibly, and we're going to talk more about that. Today, we're primarily going to talk just COVID stuff, if you will. We're going to talk about where we're at now, and then a little bit about what we're doing and how we are preparing for what hopefully we don't have to do, but we may, which is to respond to any small resurgence or pockets or clusters of COVID if it were to reemerge. I just want everyone to understand what we are doing now and have done to be prepared and ready for that if we do need to exercise those capabilities. So before we get to that, we're going to talk about where we are now with COVID-19 in Ulster County. The good news is we are still in very good shape with COVID-19. We are as good as we've been since the beginning. We now have had a cumulative 1,809 total cases over time. We've tested 36,803 total residents. We have had, unfortunately, 86 fatalities, but thankfully it's been many days now where we haven't had any additional fatalities. And we've had now over 1,604 to be exact, residents that have had COVID and recovered from COVID. And of course, that is the best news that we can have. Looking out 10 days, we're essentially still seeing our projections as flat, largely as long as we continue on the trend that we are on. More good news, our hospital numbers continue to be literally as good as they can be. We have 0 COVID patients in any of our Ulster County hospitals, so that is another sigh of relief that we can breathe. And of course, we will continue to work to keep that number right where it is. In terms of active cases in the county, meaning individuals who have not yet recovered and still have active COVID and are in recovery, that number continues to go down every day. That's been a consistent trend, as you can see on the graph, since mid-April, and we are now at 119 active COVID-19 cases. I think, if I'm remembering right, I think it's only 3 towns out of our 24 that have even double digits of numbers of cases. So we have come a long way from where we were. We are both literally and metaphorically on the other side of that peak and that mountain. And so that is good, and it's a credit to every single one of us. And I don't want us to lose track of or lose sight of how difficult it was and how much sacrifice was involved for businesses and individuals to get us there. The statistic, again, that we are most looking at right now to help us detect if there were any beginnings of resurgence is how many new cases we're having each day of new positive cases compared to the number of those being tested. So in the last 48 hours, we have tested 1,339 residents, and that's represented by those blue slices there on the graph. That's how many we're testing each day. And of the 1,300 plus, we had 9 new positive cases in the last 48 hours. So that's still a very good number. We're at 0.67%, well below 1% infection rate, and we have been well below that 1% now for at least probably 3+ weeks. So that is the most important metric. If we were to see any beginning of a resurgence or pockets of COVID reemerging, this is where we would first identify that, and this would be the first sign of some initial concern. So right now, all that looks good, thankfully, and we're continuing to watch it very closely. And by the way, it looks good now, well more than a month into reopening. So that is encouraging as well, in that we've been reopening. We're now almost at phase 4 of reopening, and in the midst of that, we're still seeing these numbers very, very good. So that is exactly what we hoped for, and that is because of the business safety plans, because of people wearing masks and distancing and hand washing. So thank you for that, and let's keep it going. Finally, in terms of hospital capacity, as I said, again, right now we have no COVID-19 patients in any of our Ulster County hospitals. and we have more than sufficient need should we, God forbid, need to do that again at any point. So that's kind of the where we are right now. And again, the top line takeaway is we're in a very good place with COVID thanks to all the work that we've all done. But I also want to take a few minutes and talk about looking forward a little bit and zooming out our perspective, not just in Ulster County or the Mid-Hudson region or even New York State, but looking at what's happening nationally and even internationally with resurgence of COVID in some other states and even other countries, including most recently reports out of China. So really, despite all the good news and the progress we've made, we are at a very critical moment in our fight to really get control of COVID and reopen. It's really that critical inflection point, I think, that we knew was coming. And what I mean by that is, again, here, as we've just talked about, we're in good shape. Elsewhere, myself and our whole team and our health commissioner, and I know other local leaders in the region do have concerns. We have seen in states in the South and Southwest, from Arizona to Texas to Florida to the Carolinas, all begin to see case numbers go up. We know, of course, nationally, just in the last few days, each day we've had a record number of total new cases, now well over 50,000 nationwide. And we know that we are connected, to what's happening around us in neighboring states and across the country because of the ability to move freely. We have also seen, and there's been some public reporting of this, now 2 early clusters in the Hudson Valley region of COVID. One due to a graduation party in Westchester County where folks that had been in Florida came home, went to that graduation and to after parties, and that has created the beginning of a small cluster that they have pretty well contained, but that is a real thing being monitored now. And then just in the last day or two, we've had another report out of Rockland County, similarly due to some sort of a house party, or I think it was actually 3 house parties among the same group of young people. We've started to see a small cluster there as well. So every day, as part of our control room, regional control room, myself and other leaders are getting these updates from our neighboring counties, hearing what's happening there and how they're responding. And so we are watching that carefully. And what I want to talk you all through is what we are doing here in Ulster County to be ready for the worst case, if you will. We, of course, hope for the best and expect that, but need to plan for that worst case. So we have to be vigilant. We have to be ready. And we have really 5 key components to what our response will be. And this week, throughout the week, myself, our health commissioner, Dr. Smith, our head of emergency management, Steve Peterson, and all of our team have been working through a series of tabletop planning drills and exercises, actually just like we did back in February before our first COVID cases hit in Ulster County, to be ready with that rapid response. So I'm going to talk through those kind of 5 components of what our rapid response will look like if we need to respond to any of these reemergent pockets. Number 1, and the most important step, is rapidly identifying if we do have the beginning of any reemergence of COVID. Now, how do we do that? Really, the main way that we identify is through our robust testing system, which, if you've been tuning into these updates, every week we're actually upping the number of tests that we are doing. We now have nearly a dozen larger testing sites, some at medical practices, some at hospitals, that allow us to test between 500 and up to 1,000 county residents per day. And if we need to do more, we can do more. So the first signal of any reemergence will come due to that testing capacity. And that's why one of the things you can do to help, and everybody can do to help, is if you think you have any symptoms or may have been exposed, or frankly, if you just want to get tested, anyone is eligible to be tested. You can go to any of those testing sites. We have all the details on our website, ulstercountyny.gov. And that robust testing capacity, especially as we continue reopening, will be the first way that we identify any reemergent clusters. If, hypothetically, we did identify them, the next step would be to investigate that cluster and figure out, okay, what's happening here. That's where we use this process that we've talked about before and you've probably heard quite a bit about, which is contact tracing. We have made, as a county and as a state, great progress in our contact tracing capacity since back in February and March. We now have much more sophisticated software that we can do this with. We have more people trained to do it, and there's also a statewide set of trained contact tracers that we can rely on if we need even more help. And what all of that lets us do is, if we identify individuals that are new positives, every single one of them that we identify, our contact tracers reach out to them, work through all of their contacts, where they've been, what they've done, and really kind of map that out. And one of the things we're looking for in that mapping out are commonalities. So, for example, if we had 3 or 4 people that were all at one particular event, or that all worked at one office or at one organization, that would signal a potential beginning of some kind of a cluster. And that would be of higher interest to us. And so that would then take us to that next step of the process, which is isolate. So what we would do in that case is we would immediately send our public health response team to that location or to those individuals. We would make sure that each of those individuals is isolated under quarantine for at least 14 days. We would do any additional rapid testing that we needed to of any other individuals at that business or organization. If needed, we might close that business for a day or two to sanitize it and clean it, and then make sure that essentially we're containing that small little resurgence so that it does not spread and kind of get out of control in the way that we were before back in March and April. So that's the third step. We've identified, we've investigated, we've isolated. The fourth part, which we will do throughout, is to communicate. I mean, this all only works if you and every member of the public know what's happening. You know that if there were a location or an event that we had positive cases at, we would publicize that so that anyone else who may have been at that location would know that they could have some risk and that they should get tested and that they should also quarantine until they get those test results. Whoops, I dropped my pen. So that is that fourth step, which is keeping the public informed throughout the process, which we have tried to do and I've tried to do from day one and will continue to do, especially if we were to exercise this kind of a response. And then finally, this is related, and we're already doing this. Another key step, the fifth part of our response, is enforcement. We have all of the existing phased reopening. We have the pause order from New York State and from the governor that still is in effect. It changes with each phase, but there are, as we know, still significant restrictions and limitations, a requirement to wear a mask, gathering limitations. Currently, that limitation of gatherings is 25 individuals. In phase 4 next week, that would move up to 50 individuals at a gathering, still with distancing and masks. So it's critical also that throughout this process, we as a county and each of us is attuned to enforcing those restrictions, which I know are cumbersome and I know are difficult and have had real economic impacts. But we know that they have worked because they've gotten us to the point that we are at now, where we're in very good shape. One specific example that have had lots of questions about when it comes to enforcement, just as an example, is a series of horse shows that were planned up in Saugerties called HITS, which did start with significant limitations yesterday on Wednesday, and are scheduled to go for the next day or two. just as an example of the enforcement we've done there, New York State actually issued a cease and desist order to HITS to make clear that their show, as it normally would occur, was not allowed and will not be allowed. So that has changed, and now they have to operate by that 25 individual limitation that every other public gathering abides by. So we actually have folks from our health department there now checking on that to ensure compliance with those restrictions. And we also do that as we get any inbound questions or complaints through the Pause Enforcement Task Force. We review those and then we respond as needed. So I ask everybody's help. If you are seeing something or concerned or aware, please do reach out and let us know. We heard from many people in Saugerties about concerns with HITS, which is why, along with the state, we responded to those to make sure we're keeping everybody healthy and safe. The only way that this is going to work is if we get that balance right between, we know we do need to reopen and get our economy going again, get people back to work, but we have to do it carefully, responsibly, deliberately, so that we don't rush and frankly end up in the place that Florida and some other states are at, which I think we all recognize we don't want to do. So I know that was a lot. Talking through those 5 components of what our response as Ulster County will be if and when we needed to respond to any resurgence of COVID. To be clear, we're not seeing that right now. The numbers still look very good, but we're seeing it in other parts of the region, as I said, in Rockland County and Westchester County, and we're definitely seeing it nationally and internationally. So it's important that we are always proactive and ready if need be. And you will hear from me and from us immediately if any of this changes, of course, and if we do think things are not looking good. I hope by now you feel confident that we're going to always lead with the data and the facts and tell you what's happening, whether that be good or not bad, but maybe less good than we'd all like. So we will always lead with that data. If you have questions on any of this, of course, you can always reach out. If you have ideas on how we can do this better, please reach out. If you have issues or needs or challenges, if you have questions, our Recovery Service Center is always available to take those questions and queries. The phone number is 845-443-8888. It's on our website, which is at ulstercountyny.gov, or you can email us at the email there on your screen. A few final closing thoughts to be a little bit more, to get everybody excited heading into the weekend. We have 2 big things actually happening in the county heading into the Independence Day weekend and into July 4th. One, our Ulster County pool will be opening on Saturday. There are significant restrictions to make sure that we're doing it safely with public health in mind, but we know how important a resource that is for many folks. So that will open on Saturday. There are capacity restrictions. There's masks required. It's for Ulster County residents only, and there are several other restrictions per the CDC guidelines that we're following. But we do think, as long as everyone follows those limitations, we can open the pool safely, and that's an important way to keep everyone healthy, and particularly to get kids outdoors and doing something, and relieve parents a little bit as well. Many seniors I know who use the pool as well. The second thing we have happening in Ulster County this weekend is our Independence Weekend salute to our frontline and essential workers. This is something we've been working on for a while that I'm excited about, and I know many others are. We're going to have fireworks on Saturday night, July 4th, and then we are also on Sunday going to have a series of parades and caravans in several towns, all at the same time across the county, to honor our frontline workers that have just been heroic throughout COVID. So a little bit, again, of a reminder and a promo, if you will, for our July 4th. This is a community fireworks show. It's open to the public. It's free. The only restrictions are that it is a drive-in. Think of this as, you know, a big drive-in movie, but with fireworks instead. You drive up, stay in your car or immediately attached to your car, basically. No alcohol, please. We need to be safe and responsible with everyone driving. And the lots will open up out at the Tech City campus out in the town of Ulster around 7:30. Fireworks start at dusk, which will probably be around the 9 o'clock ballpark. And all of the fireworks, the reason we're able to do that is in large thanks to the law firm of Minetti & Minetti that have generously sponsored the fireworks so that we can put these on without any burden on all of us and as taxpayers, given how much pressure we're under with our financial situation. So thanks to the crew at Minetti & Minetti. Thanks also to the town of Ulster, Supervisor Quigley for hosting us, and Chief Berardi and his folks in the town of Ulster Police for helping us secure that event and make sure it's safe and responsible. And then on Sunday, again, check with your town, but I know at least New Paltz, Kingston, Saugerties, I believe Ellenville. I'm sure there are more that I apologize, don't know off the top of my head, but many towns are at the same time Sunday afternoon going to be having caravans where anyone is free to join, especially those that have been our really frontline heroes, our medical professionals, first responders, our retail and grocery store workers, delivery workers, all of you that have been putting yourself at great risk. We want to honor you. We want to thank you and appreciate you. Granted, it won't be the typical parade, but we'll essentially have caravans of cars that will wind their way through streets and villages and towns in the city of Kingston. I'll be participating along with Mayor Noble, and thank you for letting me join you, Mayor Noble, in the Kingston Motorcade. That'll start at 4 p.m. at Dietz Stadium on Sunday. I think lineup probably starts around 3:30, but the caravan will start around 4. We'll get the details out about the route, so if you want to safely observe the route as it winds through the city or your town or village, please do that. And it's just a moment to, after everything we've been through the last few months, just to kind of appreciate each other, remember the fact that we're all in this together, have been in it together, but that there are some who have really stepped up, and that we want to thank you for that. So we're looking forward to it and hope everybody participates. As we go into all of these great things, my closing reminder, just one more time, please don't forget, each of us has a responsibility and a part to play in keeping our whole community safe, especially the most vulnerable members of our community. So please wear a mask, please maintain social distancing, please wash your hands or use hand sanitizer. It's working. Let's keep doing it. Let's not let our guard down on that. We're going to keep Project Resilience going. We've now delivered over 259,000 meals. So thank you to everyone that's been a part of that, and we'll continue that work. And finally, we'll be formally honoring many of you all this weekend with our salute to frontline workers, but another thank you to everyone on this list and more that have been putting it on the line for us. Thank you, thank you, thank you. And our next update to you all, it's Thursday, so our next update will be next week on Tuesday. If all goes according to plan, on that day, which is July 7th, we will be starting Phase 4, which is another important step forward. But let's not lose sight of the fact that we are at that critical moment right now. We know what's happening elsewhere. Please, please be vigilant. Keep your guard up in the midst of what's happening around us, and let's keep ourselves moving forward and healthy and safe. We've done it, so I know we can continue to do it. I know we can do it again. So thank you to everyone that's been doing that work, and in advance for those that will continue. Thanks to our team here from Radio Kingston and everyone interpreting and translating so that we can deliver our message out to you all. Be healthy, be safe, be resilient, and we will see you next week.